Hello, and welcome to the Spacejumper podcast. My name is Jared, and I am your host. Real quick, I want to give a shout out to all of the big daddies out there. Happy Father's Day to you guys, and welcome to the Spacejumper podcast. I have a very special guest today, Mr. Cade Johnson, one of the most active and busy people that I have probably ever met in my life. You, sir, are doing some really amazing things, and you have been consistent. I've known you for probably 6, 7, 8 years, maybe.
Yeah, probably about that much.
Almost a decade now. And ever since then, you, sir, have been on this path very religiously. And, looking to where we're at now and looking back, you've made so much progress over the years. And so now you, sir, are a recent McGovern medicine graduate over here in Houston,
Yes, sir.
Which is a very prestigious school to get into, by the way, and it's very prestigious to be a part of. But you are now entering into this new realm of residency at UT Health, which is going to be an extremely crazy experience because it's in emergency medicine.
Yeah, it will be a crazy experience.
So why don't you go ahead and tell us a little bit about yourself and what it is that you do?
Yeah, so I guess when I get asked this question, I always kind of start off with I'm just like a small town guy from Lumberton, Texas, which is just outside of Beaumont, Texas, but it's not really that small anymore. Every time I go back home and see the family, it's like, this is new, that's new, this is new. And so I don't think it's really like a small town anymore. I don't think it was necessarily that small looking back on it. I guess it just felt like it growing up. Right. And just decided to pursue medicine after some personal experiences. And once I made my mind up, there was pretty much no looking back. Went out to Lamar University for undergrad. And
Peckham.
Yeah, Peckham cards. And stayed there for grad school, too, in a gap year before heading off to medical school. Did 4 years at McGovern and just finished that up and decided to pursue emergency medicine, which was a change from what I thought I wanted to do originally, but that tends to happen for most people in medical school, so that's fine. But yeah, I'm going to do emergency medicine. I'm going to do 3 years here, maybe do a fellowship somewhere in something like ultrasound, and then be done, go work out in the community, and then maybe work my way back into academics over time or just stay out in the community. TBD on that. Jury's out.
Yeah, well, dude, I could see you running a big hospital. I could see you. Because it takes
into admin.
It takes a very special person to handle all that business. And for as long as I've known you, you are completely active and proactive with everything you do. So that's what it takes. That's what it takes to be great. So I guess the big question is, why emergency medicine? Because it's hectic.
It is hectic. Yeah, keeps you on your toes, man. I guess heading into med school, I wanted to do peds hemonc, which is pediatrics, so working with kids, and then hemonc, hematology, oncology, kids who have blood cancers, so things like leukemia. And that was really what I was focused on, and I thought that specialty would give me the things that I really wanted out of a career and out of medicine. Walking with people through some really tough times was one of the things that was really important to me as an individual. Something I wanted out of life, out of my career. And I did a bunch of shadowing with emergency medicine in undergrad, but quite frankly, that was just what was available for shadowing. And so I just went and did it because it was easy. You could go in kind of whenever you wanted. It worked with my hectic undergrad schedule. Right. And so that's just what I did. And then I decided to go in and do some shadowing with that during med school and see what it was like as a medical student, having learned some things. And it's pretty much all she wrote from there. Wow. I soaked up every bit of that experience, and it was chaos and it was fun. And then and I was like, okay, this is fun. I'm just gonna have a fun career. Right. And the more I really dug into it, the more I found that, hey, this really offers me everything that I want as well. Every day's different. Every shift is different. A little variety. Yeah, I never know what's going to walk through the door. It could be something not that bad. It could be something really terrible. And more importantly than me getting, some variability in my workday was I realized that all the really bad experiences that I had in my journey with cancer, the really bad days, I would end up in the emergency department. They're like, when I look back and I'm like, man, remember that time, I had a anaphylactic reaction, full body allergic reaction to that medicine. Man, that was crazy. We had to turn on, we went to the emergency department and realized, hey, people in the emergency department, nobody there is having a good day. Right. You're still working with people who are having what is likely one of the worst days of their entire life, whether it's because they are in there themselves for an injury or because they're with a loved one. Nobody in the emergency department's having a good day, man. Yeah. And you, as an emergency medicine physician, have an opportunity. You get to walk through that with them, and you have a chance to really turn that around for them. And if you can't fix the problem, maybe you can get them to someone who can, or if the problem is unfixable, maybe you can help them get closure, or if their loved one is passing and dying, you can help them get closure, and you can help them navigate those waters, and you're the first person there that they kind of walk with through that. And to me, that was really, really powerful. And on top of that, it's not a clean specialty of medicine. There's not the theater lights of the OR, and the patient's not prepped and draped and cleaned, and everything's not sterile. And, and that's the surgical side of stuff. And the inpatient medicine side of stuff, the patient hasn't been given a bath yet. They haven't gotten this or that. They haven't had the chance to maybe even sleep or, whatever, or eat and do personal hygiene stuff. And yeah, it gets kind of nasty down there in the emergency department, but it's real and it's raw, and I appreciated that, and I wanted to be there for the real and the raw stuff, and be there on those days for people. Again, because when I looked back on my experiences, on the really, really bad days, it was, man, I had to go to the emergency department. Yeah. And they were awesome. They helped me get through that. And it wasn't as bad as it could have been because they were there and they knew what they were doing and they took care of me.
Right. Yeah. So. And I completely agree. The most serious is accidents and things that I've had. I ended up there, and it's that front face, that smiling face that for physicians that really can, because the ER can be an overwhelming experience for a lot of people. Absolutely, and it could be a setting that not everybody is walking into daily, so they're not used to it, and so it's just this big world of just hecticness, and so people like you are definitely necessary to stand on the forefront and be prepared, because that's another thing, is being prepared. I mean, you can't just throw anybody into the ER and say, here, take care of this patient, he's coming in, gunshot wound or whatever. Right. It takes like I said, it takes a very unique individual, and I'm sure that you work with a lot of brilliant people that are very good. So you received pretty good training. I'm 100% you did, but how was your experience over at McGovern?
It was a pretty fantastic clinical experience, man. The book work of medical school, in my opinion, is vastly the same. No matter where you go. Right. Everyone's using the same types of resources to learn. We're all learning the same things because at the end of the day, we're all studying for the same licensing exams, which cover the same material. Right. So we're all learning the same bookwork type stuff. The clinical experience, I think, at McGovern in the TMC is really unparalleled.
Extremely good.
There's just the breadth and the depth of the pathology that you have the opportunity to see is crazy. There is almost every subspecialty. So if you want to learn about a subspecialty, you have the opportunity to go find that subspecialist and say, hey, I want to spend a day with you. And then when you're going through rotations and you're picking, for surgery, I want to look at this type and this type. And there's so much. Yeah. There's so many options, man. It's crazy. And so that was that was really nice. And
The
then
human
that's
body's complex.
yeah, it is.
There's
It's nuts,
Yeah.
man. And that's like the TMC side. And then we rotate out at a county hospital with Harris Health System called LBJ Hospital. And it's awesome for training as well. And the patients out there are super appreciative. It's a lot of low income, low SES patients. That hospital is located in what we call like a healthcare desert. So it's the only hospital for a while out there.
Wow.
And so people from that entire area, you know, if there's something wrong, that they're going to LBJ. And it's a really fantastic place. A lot of those people can't get primary care. And so their pathology, their disease ends up progressing till it's really, till they're in a really bad place. And then they show up to the emergency department. And unfortunately for them, their disease has progressed and it's really bad. But on the learning side, it's really good to learn what that looks like so that you're prepared for the worst of the worst. Because a lot of these patients, again, unfortunately, are coming in with the worst of the worst because they can't afford or can't get access to healthcare. And so you're seeing some people who are really bad off, which is good for training. And then you get to help them navigate that, which is rewarding on a lot of levels.
Right. And probably just seeing how different processes are done, you know, because I'm sure that at that hospital, I'm sure that processes are done differently than, you know, somewhere like in TMC, you know. And things like
totally
that.
different system.
But it's for the same reason, you know. So you could tackle the same problem multiple different angles, and I think that that's a great way to become familiar with treatment, you know, and things like that, knowing that there's not just one path that leads to a good outcome. Now, just to back up, I know that you said that your personal experiences kind of led you into this direction, and you mentioned cancer. Is there a history there, a background?
Yeah. So when I just turned 11, a couple months after I turned 11, I was diagnosed with acute lymphoblastic leukemia. Went through the whole treatment regimen at that time. Was in remission really fast. My parents were awesome. They started noticing the signs super early. And so the percentage of my white blood cells that were cancerous was very low compared to when it's normally on average diagnosed. So caught it relatively early.
What kind of symptoms were?
So thankfully, I was a really active kid playing a lot of sports, and my mom was a teacher, so I was involved with UIL stuff after school. So just running and gunning every day. And
not much has changed.
Not much has changed. And so started getting tired, and, you know, asked my mom, was like, hey, and, you know, in retrospect, this is really weird for, you know, like I was in fifth grade, for a fifth grader to say these things.
Right.
I was like, hey, Mom, can I not do UIL this year? And she was like, I mean, you've always loved it, but, you know, why not? And I was like, I'm just tired. I just don't want to do it anymore. Like, or not this year, maybe next year. I'm tired. And, you know, that was kind of, she was like, oh, it's kind of weird, but maybe he's just burnout, you know, and wants to do something else in the afternoon. That's fine. Or maybe wants to play more sports or come home and just play. And she was like, yeah, that's fine. And then we were out at the straw that broke the camel's back from my parents. We were out at a baseball tournament one weekend, and the team I was on, we were playing a doubleheader. And we had probably, I'm going to guess, like 30 minutes to an hour between games. When you're 11 years old, that's nothing.
Right.
You know, like you just turn around and you play the next game, and then you go home and you play in the neighborhood for a couple hours because you just have all this energy.
Right.
And I tried to take a nap between games because I was just tired, man. And they were like, something's wrong. We got to get him to a doctor. And my pediatrician in Beaumont, he ran a couple of tests, and he was like, hey, I'm gonna send y'all to Texas Children's and let them do a bone marrow aspiration there and see what the results are there. That way, if they're bad, you can get treated there and you're already kind of plugged in.
Right.
And if not, no harm, no foul. And so we went up there, got the test, and came back positive. and then started treatment like the next day.
Wow.
So,
Started treatment at Texas Children's?
yeah.
Wow.
Started
Shout out
treatment, like, the
Texas
next day.
Children's, by the way.
Yeah.
I got life flighted to them years ago. I got bit by a snake.
Oh,
and when I was
jeez.
young, I was probably 10, 11. And yeah, they took good care of me, man. It's a great hospital.
Yeah,
honestly,
I no hospital's perfect, but they're all right in my book. Man.
Right, yeah, right.
I'll take them any day after what they've done for me. So.
Right. So how long did that take to clear up?
So I was in remission, which means like the percentage of white blood cells that were cancerous was below a certain percentage, whatever it was at the time. I think it was like less than 1%. I was in remission within like a month or two, just getting blasted with chemotherapy and just knocking them all out real quick. But the total treatment time was, man, I think it was like 5 years, something like that. But it was a lot up front, just to kind of knock everything down,
Right.
and then after that, it slowly starts
Steady
tapering
flow,
off.
yeah. Wow. Well, it's amazing because that molded who you are today, you know.
Yeah,
and
absolutely.
And you've become such a good leader in the community, and you know,
Appreciate that.
we need more people like Cade Johnson, sir. We need more
Thank you.
people like you. I remember
Appreciate that.
back in undergrad, I would see you running all different classes, and I think we had a couple classes together, and I think you were running like the max. I mean, I think you had to get approval from like the dean or something. You're running like 18, 19 hours, like credit hours.
I think there was one
insane.
semester where I was running over 18, but most of my semesters, unfortunately, I don't regret it. I would never do it again.
Yeah.
But I think 16 was like the least I ever had, and that was probably my last semester or second to last semester.
Oh my God.
And partly because I was doing a double major, and that was just what it took to get it done in a reasonable amount of time.
Right.
Which was unfortunate for my schedule, but we made it. So
Yeah, hey, we made it. Hey, let's actually talk about that real quick. So you graduated Lumberton High School.
Yeah.
You went into Lamar University, and you got a double major in biology and exercise science.
yeah.
Wow, and a chemistry minor.
Yeah.
That's ridiculous, dude. That's like insane. Like
To be fair, the chemistry minor, I think it might have just been one extra class
Yeah, a
or
couple
something
extra
like
classes,
that. Yeah,
yeah.
because with doing the pre-med stuff, you already have to take chemistry and OChem, and I think it was maybe one extra class, or maybe it was 0 extra classes, and you just had to document that you were doing a chemistry minor, even though you already had to do that as a pre-med.
Right.
But yeah, you just like had to document it. I think that's what it was. It was like 0 extra classes, but it was technically a part of the pre-med coursework.
I have my minor in chemistry, but I don't tell people that. I'm like, yeah, I got my minor in chemistry.
You should. You should tell people that, man.
I'm like, yeah, I got my minor. It was a lot of classes I had to take. But yeah, no, it's really insane. Speaking of the chemistry minor, you had Dr. Martin, huh?
Oh yeah,
Dude, Dr. Martin was awesome, man.
He was. A lot of people did not like this professor at Lamar University. I loved him.
He was amazing.
He was amazing, and
He was such an ass, and I think that's what made it awesome.
He could be, but I thought it was like in a funny way.
Yeah.
I guess to each their own. Other people might not take it that way, but he would give me a hard time, and I loved it.
Exactly.
And I think I always knew from him, it was coming from a really good place of, I want my students, I'm trying to draw the best out of them.
Exactly, yeah.
And I want them to like work hard to understand this,
Right.
not just to memorize it for a test. I want them to understand what's going on here, so that they can actually take that with them and do something with it. Yeah. And not every professor is like that.
He was the best professor I think that I've ever had. I mean,
He's for my experiences at Lamar, I would say he's top 3 or top 5 for sure. And if I was placing those 3 to 5 in a pecking order, it would be tough.
Yeah,
because
yeah,
there were some really, really great ones out there, and who cared like that.
Right.
And then the rest of them didn't care like that.
Right.
But those 3 to 5 who did,
he
were
was very
awesome.
adamant about it. I mean,
He
and
was,
the
yeah.
thing was, he was brilliant.
And he would be
was very
upfront
smart.
about it too.
Yeah.
He was like, hey, you had the option to take me, and you had the option to take someone else. Whether you chose me or you ended up with me, maybe you're happy about it, maybe you're not. But you're in the boat you're in, and this is what this class is going to be like. So he was upfront about it.
He was upfront,
You knew day one what you were getting into.
Yeah. He was one of the very few classes that I would show up to and be like, man, I have to go to this class. Like, you know, I mean, I think he's actually teaching education, you know, because he was doing, he taught chemistry, and he also went to a lot of education conferences on how to teach people and like how, like what causes people to retain information, and like what's a good teaching method and what's a bad teaching method. And I was kind of looking him up recently, and I think he ended up moving to like North Carolina or something, and he's like teaching other professors how to teach.
Yeah, that sounds like him.
Yeah,
I knew he was, when we were kind of on our way out at Lamar, I knew he was starting to get ready to move, and I knew it was going to be more north than Texas, because I think he's originally from the Ohio area.
Yeah, that's right.
Something like that.
Yeah.
And he wanted to get back up there a little bit closer to family, and he was looking for jobs up there and stuff. But it does sound like him to be teaching other professors how to teach, which is exactly which he's brilliant at that.
Exactly. So. Yeah. Pushing electrons somewhere. He's out there pushing some electrons.
Yeah, doing chemistry.
Yeah.
Yeah.
And he loved it too. You know, he would even like, we would be reading textbooks, and he'd be like, all right, look, is that even practical? Like, let's think about how we could how we could grow penicillin and treat ourselves, like in case of like a, you know, something happens. You know, and this was like pre-pandemic too. You know, so he always had that like, let's apply this to life type method. You know, and I think that's awesome. And he had a brewing class. Did you take the brewing class?
Man, I'm still upset about that, man.
Honestly, I think about it often.
I did not take that class, but by the time I heard about it and I went to him and I was like, hey, I heard you teach this class, but I don't like, I looked in the course catalogs. I don't see it. Like, can we do this class if I get enough people on? And he was like, man, I basically can't teach it anymore. There was, he taught it, and, you know, it was a very popular class because how cool is that? Yeah. Or how fun is that?
Everybody wants to know how to brew beer, you know?
It's fun, man. I'm telling you, it's a great hobby. But he basically got complaints from some locals. Because it was printed in a paper, there was a news write-up about it, and people complained to the university about it, and long story short, it got shut down. But yeah, there was somebody who before me also tried to like petition the university to teach it, but he kept all his notes, like, you know, the class in a file folder. He kept all of it because he had it set up for a semester-long course with a lab, and man, there was some good science in that class, and it was all applied OChem to brewing.
Right, exactly.
Which is awesome.
Yeah, that's, I mean, you're getting like 99.9%, purity.
Yeah, exactly. And he would get, I think either he would teach it, or maybe part of the course he would get an engineering person to come in and teach. But he would even, if I'm not mistaken,
that makes sense.
It would be like the engineering side of running a massive brewery with with the pumps and all liquid, all the liquid all the math that goes into that. They would, I think, even talk briefly about that, because if you go get certified, there's some certification. I think the test is out in California a couple times a year, and you can go do this. But part of it is knowing the engineering side of things for troubleshooting out in the real world. You have to know this stuff, and so I think he would even like dive into that, and that was pretty cool. But yeah, I never got to take it, man.
That's such a mind-blowing topic too. Yeah. And I could see where it would threaten locals, because I mean, there's people that are, trying to, brew their own stuff for business, and I'm sure they're looking at it like, man, these people are like applying like high quality science to this. We're going to be out of business if we don't,
I think it might have been it was before the breweries started opening up in Beaumont. But yeah, man, and I think it would have been a great class to have like partnerships with local breweries once they had started opening up. So you go do like site visits and be like, this is how this place does it. This is how this place does it. Now let's, now that we've done the class for the day, let's have a drink. So which would probably have been a pretty cool college class to get credit for, would have been a fun time.
Wow.
So.
And so I guess that kind of leads me into this whole endeavor that you're doing now. So you're you're brewing beer as a hobby now. Is
Yeah.
that correct?
Yeah, it's awesome. It's
Wow.
fun. It's challenging. It's rewarding. It's a
Wow,
good
wow.
time.
And you have your own logo and name for this. What?
Oh yeah, maybe one day down the road, you know.
Yeah. Well, why don't you go ahead? How did you get this name? It sounds so fancy.
So
James Anthony.
Yeah, so
Give me a glass of James Anthony.
Yeah, exactly. And so I started.
1 pint.
It's actually a great segue because Dr. Martin, he was getting ready to move, and I had approached him about this class, and he was like, "Oh, are you getting into brewing?" And I was like, "Yeah, me and one of my buddies are getting into it." And he was like, "Well, man, I'm trying to get rid of my brewing equipment, and I need it to be gone, and I need it to be gone fast, like really trying to make room in the house and stuff, and I'll sell it to you on this discount." And it was crazy. And so me and my buddy went in halvesies on the equipment cost. And so we started brewing, and we were like, man, if we ever like did something with this one day, you know, what would we call this? And we were spitballing all kinds of dumb stuff. I don't even remember what some of the other options were. And the one that just popped into my head, I was like, well, his middle name was James. My middle name is Anthony. I was like, James Anthony, that sounds pretty good.
Sounds fancy, man.
I was like, I like that. I like the way that sounds. And I texted him about it. He was like, dude, that sounds great.
Yeah.
And we just wanted like an Instagram page where we could document kind of what we had made, what we had done. And so that's how that page came about. And now I'll make beer, and I'll bottle it sometimes. Sometimes it's just on tap in the apartment. But yeah, I'll bottle some of it up sometimes, and then just kind of hand it out, you know?
Wow, that's amazing. James Anthony Artesian Ales.
Yeah.
That's top notch right there. So do you plan on, I mean, you know, cause you are a couple years away from being out of residency and things like that. So is that something that you kind of want to ramp up on the side eventually?
Eventually it would be nice to if the stars kind of aligned or came close to aligning, you know.
Right.
It'll never be the perfect time. But I don't think right now or anytime soon is a great time.
Right.
A lot of breweries, especially even in Houston, but really I know in San Diego some have also been shutting down. So kind of I think across there was a almost kind of like a craft beer bubble burst, if you will. I think especially the pandemic hit the industry really hard because it's not a necessary business to have per se.
I feel like
in
that
the
would've
context of
ramped it up,
COVID.
you know?
Well, if you were working at a place that had the ability to can and or bottle, and you could distribute out to liquor stores or to, you know, grocery stores and have your stuff, then you can still make money. Or if you can have people come pick it up at your site, you know, and it was contactless, you could still make money. But you know, if your business wasn't set up that way, if you didn't have the equipment to do that, man, you were kind of toast.
Yeah.
And so I think that killed a lot of breweries off. And then I think really just kind of the hype around the industry died off a lot. There was a while there, and I was a part of it. But people would, you know, you would pay big money to trade someone for a bottle of, you know, fancy beer, one-off release from this brewery that you love and that you didn't get, and you would pay them, you know, significant sums of money.
Right.
Or for, you know, the places would make like limited time glassware, and it would be paired with a beer that they were releasing, and the logo was really cool or whatever, and the glassware looked cool, and people would pay significant sums of money. Also, depending on how limited the glassware was, there were people who would pay a couple $100 for like a glass, which is nuts.
Yeah.
And all that really just died off eventually. I think that's part of the reason. And then also, you know, I think the consumers become more educated in what's good, what tastes good to me for beer and what doesn't. And I think a lot of breweries, maybe not a lot, but some, I think some breweries were getting away with, we're hip, we're cool because we're a brewery. And I don't think that's enough anymore just to be a brewery. I think you have to put out a good product, and you have to have other things too for people who aren't beer drinkers. Maybe you stock some NA beverages, whether you make them or not, maybe you stock it for people who don't want to
Which are
drink.
popping off also.
Yeah, they are. They are. It's gonna. I think it's taking over a pretty significant segment of the craft beer market.
Yeah.
And then
And then they're making a lot of THC seltzers and things like that. It's
hop water is becoming a thing where they just put the hops in from the beer and carbonate the water, and that's a thing now. And so those are all beer adjacent products that are coming out and taking up some of that market that are probably either require specialized equipment or are difficult to do on a small scale. You not really profitable on a small scale. You'd have to be like a big place to really make that worth the while to produce it. And so tougher on smaller breweries to stay open. And then you need wine, or you need your liquor license in Texas, however the licensing is set up to serve other options, and food too. People want to go out to eat with their friends, not necessarily just go grab a drink. And so those are all things I think that have chipped away at some breweries who just came out and were banking on making money because they were a brewery and it was popular. So.
Well, hey, I'm not counting you out anytime soon, Mr. Cade Johnson. You're not going to slip away with the fact that you have an MBA also. I mean, that's an another yet impressive degree, because a master's in business administration. What was your concentration?
I just did a concentration in leadership because the way the program was set up that I did at Lamar was like a +1 program. And so I was getting credit for some of my undergrad classes at the grad level because I was doing them at Lamar. And I think the way it worked out was the only way that I could get a focus in my MBA was to do leadership, which was fine with me. I think it's a great topic.
It is, yeah.
But the other ones would have required more classes, and I wouldn't have been finished. Maybe it didn't require more classes. Maybe it required me to take classes at specific times of the year that would prevent me from finishing before med school started. And I was like, well, I'm not going to be finishing up my MBA classes during my first semester of med school. That's a hard pass for me. So I went with leadership, which I was perfectly fine with. And I enjoyed the specific classes I had over that, doing strategic management stuff and how does leadership play in with management and what are the differences and all that kind of stuff.
It's a big aspect. It's very important in business and in medicine. If you ever wanted to open your own practice at some point in your life, it would be it's a very great tool, because a lot of people don't have the leadership skills or these management skills that are required when you're dealing with insurance and when you're dealing with just patients in general, and having to deal with everything that comes behind that. I mean, it's a very unique skill to have. And I looked at going back and getting my MBA over here at Rice, and I mean we're wanting just an absurd amount.
That was also part of the reason for staying at Lamar. It was on a budget. It was affordable, and it was all the same types of information, and, and all the same types of testing.
And debunk the fact, because I know you may know some of the same people that I know back from the Beaumont, Lumberton area, but a lot of the locals in that area, they think that just because they grew up there and things like that Lamar is in some form or fashion lacking in the education that they offer and things like that, but. I believe that you would agree with me that that's not the case. I
don't think so at all.
They employ very educated people, and they're teaching in very effective ways. I believe that you're a good example of this. Because now you've made it so far since you've come from that baseline of Lamar University, that where you got your base education and your undergrad.
And there's a good cohort that I graduated with that we all went off to medical school. They're all doing good things. They all finished medical school. They're all, and some of them went to some really good medical schools. So it's not. It's one of those things where it's not impossible to make it from here just because you're here or something, to that effect. It's really I have this, and now I need to make this my opportunity to make it to the next level. And maybe because it's a smaller university, the onus is a little bit more on you, just because there's no brand name recognition. You know, you're not like, oh, I graduated from UT with a bio degree or whatever degree you choose to do before medical school or whatever your chosen profession is, or A&M. There's no maybe brand name recognition for Lamar, but that doesn't mean that you can't make that up with a little bit of extra work. And I think that a lot of the people in my cohort recognize that, and they're like, hey, we just have to do, we have our coursework, and then we just have to do a little bit of extra stuff to make ourselves stand out, and we'll be just fine.
Right.
We'll still make it. And I think that's perfectly acceptable, and I don't think my education was any worse off. There were people from bigger universities, better universities, who probably did a lot better than me in medical school, and there's probably a significant amount whose grades were a little bit worse than mine, and that's, you know, just how the cookie crumbles. And medical school is different too. People might not be. I had a buddy in medical school who said, "Man, in undergrad, I was never the guy who made, you know, the 95 plus on every exam in every class. That was not me." But he got to medical school and things started clicking for this guy, and he crushed every exam. Wow. He was the guy knows everything. Yeah. And so we joke in our group text. Those people. We joke in our group text, and we refer to him as the literature. Yeah. And because he knows everything that there is in the literature. So he's just a crazy smart individual. But he was like, yeah, I wasn't that guy in college. Yeah. And so, you know, things change in med school for people, and maybe you were that guy in college and you're not in med school. Maybe vice versa. Right. Whatever the other permutation of that is.
I think another thing is, you know, in undergrad, you're taking classes like English and you know, social arts or social studies and government and all these different classes. And then when you get into medical school, it's more focused. You know, you have more, you know, pathology and
you're going real deep
anatomy,
on anything you touch on.
Exactly. So it's I think it's more focused, and I think it probably clicks with a lot more people because that's what they genuinely want to learn. You know, and it's, you know, like I said, we need more people like that, man. It's we need more people like shout out the literature. but yeah, man, it's and as far as you went through medical school, you recently graduated and you found your wife there too. Huh?
Yeah, I did.
Wow. Man, congratulations on that.
Thank you.
Houston's so big. I have been unsuccessful yet, but
it'll happen.
It'll happen, man. I guess I need to.
She just has to move here. She's not here yet.
Yeah. We're gonna have to start looking at least. I know there's I was laughing because, you know, I live here's my apartment, and then next door is my cousin.
Oh, nice.
He moved in over there, and right across the street is a restaurant. And they have this like dating event. It's like a pickleball, like singles only dating event.
Nice.
And I was like, dude, we need to hit this up.
You should, man. That sounds like a fun time.
Have you played pickleball?
I have. I was never. I think in undergrad I played some racquetball with one of my buddies at the rec. Every now and again, but that's really the only like racket sport I've ever participated in. So when I started playing pickleball, it's a little bit steeper of a learning curve because I've never been good at, you know, ping pong either.
Yeah, I'm not good at ping pong.
And so it's a little bit tough. It's just, I don't think I'm built for racket sports. I think there's a lot of practice there that I don't have for that baseline level of skill.
Yeah. I know. I have been significantly ineffective as far as anything that has to, like, I like to run in the mornings and things like that. But as far as like being completely agile and things like that, it's kind of tapered off in a sense where a couple years ago I was jumping on my little nieces. They have a trampoline, and so I was trying to bounce them as high as I could.
Right. Yeah.
Well, they ended up double bouncing me, and instead of projecting me upward, my knee just collapses under me. And dude, it hadn't been the same since. And so I have to be real. I have to be real careful, because if I go off to one side or the other, my knee will just collapse. You know. And it's I never went and got it checked. It's one of those things where I was just like, it'll be fine. It'll be fine. Yeah. I'll quit bitching.
Yeah.
It'll be fine.
It'll be fine. Just you need to do some strengthening exercises.
Yeah.
Get everything else around it strong, so that
Exactly.
whatever that thing that got torn or weakened up has the support it needs, man.
Well, that's been a couple years ago, so maybe. But honestly, I do some strengthening exercises, and man, I don't know what it is. There's just that one movement that if it gets off centered,
Yeah.
it's done for. I really should go get it checked. And
I as a physician, I would say you probably should. Yeah.
and then last weekend, or I say last weekend, probably a couple weeks ago, I had my 10-year high school reunion.
Oh, nice.
And so,
How was that?
It was awesome, dude. It was actually a really good time. And, I got to catch up with a bunch of people that I haven't seen in years. And it was a really good time. We let the liquor flow a little too hard towards the end of the night.
goes.
Yeah, I believe everybody went to Little Woodrow's in Beaumont, which
There you
was nuts, by the way. I haven't been to anywhere in Beaumont in a while, and I walk in, there's tons of people there.
Yeah.
But by the end of the night, all the guys were like testosteroned up and like arm wrestling. And so I had a couple tequila shots in me, and so I was like, "Yeah, I'll arm wrestle," knowing good and well I'm getting old and I'm not as strong as I once was. But yeah, I start to arm wrestle and we say go, and as soon as we say go, my elbow just clicks,
Gives.
and I'm like, "Man, I'm done. I'm going home."
Yeah.
So, but yeah,
That's what my dad says. Keep waking up one day at a time. You'll get there.
Yeah, and I believe it, because yeah, it's the human, like I said, the human body is complex, and there's definitely a biological clock. It's real,
Yeah.
Is
It happens fast, man. It'll sneak up on you too. But yeah, the running's nice. That'll keep you young. You just gotta be careful with it. Running's been taken off.
Yeah.
I feel like recently a lot of people are getting into it. Me too. Guilty as charged.
Yeah.
I think it's taking off a lot right now, and I think a lot of people are realizing, hey, like I have like this knee thing, this hip thing that's like really bothering me now that I've started exercising a little more regularly and realizing, oh, like I should take care of this. I should take care of this body.
Yeah, I mean, once it gives out, I mean, you start realizing like how much you probably should have appreciated it before.
Right. Yeah. Absolutely.
And it's definitely when your body gets hurt, it takes a hit, and then you start realizing, dang, like, man, if my elbow is just feeling better, I would go do this, or if my knee was feeling better. But you, sir, speaking of running, is that how? I mean, emergency medicine is a very stressful line of work. So is that how you're keeping your mind clear and things like that?
It can be sometimes. Sometimes running for me is good when I'm frustrated. I feel like it's a fantastic way for me personally to blow off steam. Mostly though, for me, it's just my way of staying healthy, staying active a lot lately. I have grown to enjoy it more. 4 years ago, I remember very vividly making the comment to one of my friends, somebody, and I said, I just don't see the utility in being able to run more than 1 or 2 miles. I just don't see the utility in that. And now I run much more than that regularly. And I see the utility in being healthy with it and using it as a tool for my fitness and for my health. And I think that's more of what I use it for. For stress relief, man, I think a lot of emergency medicine doctors have like pretty wild hobbies in terms of like adrenaline junkie stuff or outdoors, extreme skydiving, rock climbing. There was a recent study that came out of the UK, I think, and they compared life expectancy of different physicians by specialty. And I think, a lot of them were relatively high and pretty similar.
Right.
And then you have this one drop off, and it's emergency medicine. And I think the conclusion was like, well, yeah, these are all the people who are going skydiving and engaging in high risk activities and stuff for fun. And I was like, that makes sense. And somebody the other day was asking me, they were like, what's your like high risk activity? I was like, I mean, I don't know. I run, but I look twice before I cross the street, and tons of people run. So I wouldn't qualify that as necessarily high risk. And then I was thinking about, I was like, oh, well, I am scuba certified, and that, that can be high risk. I don't see myself going and doing much, cave diving anytime soon, or going and trying to, like the anesthesiologist did, and going and trying to rescue the kids in the cave. I don't see myself doing anything like that, but you know, it is still a risk to go underwater like that.
Yeah.
There's still sharks and stuff.
Yeah,
So.
and let's be fair. Anesthesia, they're psychos anyway. So
Hey man, they get to do some cool procedures, and they know their stuff about all the intubation meds and keeping people under. And
I like to give my brother a hard time.
Dude, a lot of the people that do anesthesia and go do like specific services like the cardiothoracic surgeries, those anesthesiologists, they're on top of their stuff.
Yeah,
and
you
they're
have to be very.
They're changing things up all throughout
sharp,
the surgery, and they're on top of it, man.
Yeah.
So they definitely know their stuff. But yeah, I mean, it takes a special person for every
You said
specialty.
they saved somebody. What is the story behind that?
I forget what there was flooding in a cave. I want to say it was Thailand, but maybe it was somewhere
this
in
was
South
a couple
America.
years ago, right?
Yeah. It was like the
I think I
soccer
remember
team.
that, yeah.
Yeah. And it was an anesthesiologist from somewhere in Europe that they like went in and put the kids to sleep and like brought them out and
Are
like
you
put
serious?
tanks on them. Yeah.
That's crazy. I didn't know that they did.
Yeah,
that.
it was pretty wild.
That's
I'm
legit.
sure some of his colleagues frowned upon it
Yeah,
significantly, but he saved a bunch of lives. So.
Yeah, hey, that's the name of the game, honestly. Wow. Yeah, man, I've seen some insane cave diving videos. I mean, I've heard some stories about people almost getting stuck and not being able to find their way out. Man, I don't know. I haven't ventured out and been skydiving yet. I feel like I want to one day, but I'm not there yet.
I've done it once, and I don't think it's something where I would go upon further thought. I don't think I was thinking about it at one point, but I don't think it's something I would go get certified to do by yourself, because it's just, for me personally, it's like time and money to go do that.
Right,
and then B, it's like, okay, well, if I go through all of this to get to do this, I should do this regularly,
right?
Because I invested to enjoy this.
Right.
And so if I'm not going to go do it regularly by myself, why would I go through that? And I think the conclusion was just like, if I ever wanted to do it again, I'll just go pay to do it tandem with someone on the back.
Yeah. What does that run anyways? Like, how much
I think it was a week. The place we looked at, me and my wife were talking about doing it, and we looked into it, and I think it was like $5,000, and it lasts like a week. But that included like your hotel and them feeding you every day. And basically for a week, you would just stay in a hotel right by the place where they took off from. And you would just, Monday to Friday, you're just banging out jumps.
Wow, getting reps in.
Yeah, and then they progress you through all the stages in the course of a week, or maybe it was 2 weeks, I don't remember. But they progress you through, and then you're done and you're certified and you can jump by yourself.
Wow. Yeah, no, I'm good, man. I don't like depending on. I don't like depending on any type of mechanical object. Even the cars these days are sketchy. But yeah, man, if I went to pull that string or whatever and the chute didn't come out, or it came out and it was just like stuck and not opening, man, that would
panic
that would
mode.
be
panic mode real fast.
I'd look down. Have you seen Red Bull? The guy from Red Bull jump from like way high up, almost like
he did like the helio jump or whatever. Had all the special gear.
Nuts, absolutely nuts. And I mean, you could see like the curvature of the earth. I mean, that's crazy.
Yeah.
I watched that video recently, and as soon as he hits the ground, he's like tearing up and so happy he's on the ground.
He just made it.
Yeah, I mean, it's I think in that situation he hit like. I keep wanting to say Mach 1. It's not Mach 1. He broke the sound barrier, and like the people on the ground can hear his body just like hit the like. I mean, it sounded like a freaking rocket.
That sounds scary.
Entry. Yeah, it was nuts. Yeah. But yeah, like I said, I haven't ventured out and did it yet. But maybe one day. Maybe
did he have like the little squirrel, the flying squirrel suits?
No.
Oh, okay.
Yeah,
no, he didn't.
He was just. I don't think so actually. Now that I think about it. But cliff diving would be crazy with the squirrel suits.
Yeah, cliff diving is pretty nuts. Yeah. And it's all just, you are 100% relying on whatever the support material or support apparatus is. It 100%. You're relying on that thing to come through for you every single time you jump or go underwater or whatever it is.
Yeah, I could see myself just flying right into a tree or something ridiculous. Like I haven't even been skiing like on like,
Oh, skiing's a good time.
Yeah.
Stay on the bunny slopes, get your feet under you.
I'm barely okay with hopping in like a skating rink. I'm like, man, I'm gonna bust my sacrum or something. Like,
yeah, we went to a skating rink up north of Houston earlier this year with some friends, and one of my buddies, he was having a rough time. It was fun for everyone else, especially watching him, but he was having a rough time.
Oh my God. Yeah, that's crazy. Well, I guess that's work hard, play hard. You put in your time, and you proceed in your career to get to a point where you are financially stable to allow yourself to do whatever you want, and you sort of on that path, which is amazing. But to get here, you've had to jump so many obstacles, and I believe the first one that a lot of people just starting out that are thinking about is the MCAT. The MCAT's a big, scary obstacle for a lot of people, because it's this big, long test that includes a lot of different sections, and you have to be well trained on reading, and critical thinking, and just the ability to process things, as well as the science, because you have to be kind of have a well understanding of many things, and you hurdled over it like nothing. So
I wouldn't say that.
So how was your experience studying for the MCAT?
Yeah, it's a beast of an exam, and they become more beastly in med school, and I think that's almost the point of the test to some extent. Is, hey, we need to know that you can sit down and study and do well enough on a really long all-day exam. I think it's something like 7.5 hours of test time, and you get like an hour break to intersperse how you want. Ridiculous. Or something like that. It's something pretty
ridiculous.
Nuts. Yeah, and part of it is they need to know you can do that, because that's how all your licensing exams are set up. They're all-day affairs. It's like 45-minute blocks or 60-minute blocks, whatever it is, and then you get break time that you decide how you intersperse between the blocks, and then it's like 8 blocks of that. It's nuts, and it's not fun, and they need to know that you have the mental stamina to get through that, and I think that's part of it. And then, when you're studying for the MCAT, it's like these chemistry questions, these physics questions, and you're thinking to yourself, this isn't like anatomy, this isn't physiology, this isn't why am I having to take this huge test over these things? And it's really just the baseline knowledge for, how things in the human body do work. Because those things are relative. Granted, if you're talking about those things with regards to anatomy and physiology and how things flow and work, and how medications act in the body, it really does get down to the chemistry level and how things attach, how different molecules are attaching to other ones and things of that nature. And then flow rates with physics and how much fluid can I push in through an IV. All those things become relevant. And so I think if you can realize that, hey, this is relevant in that aspect, it makes it a little bit easier to study for. And then the last thing I think is it's scored. So there's just all this pressure on you, and the average scores keep going up. And so the pressure keeps going up, and I guess, not necessarily IQ of people taking these tests, but the ability of them to score high on these exams, whether it's because their IQ is higher or because they're using better study materials and study resources. Those are all things that are increasing. And I would definitely go back and study a lot differently if I could, doing a lot more spaced repetition. I thought it was just, I just need to do practice questions, which is a huge part of it too, and do tests. But I really wish I would have done more like flashcards, just to really establish like a baseline knowledge, and then used practice questions to learn how to apply that baseline knowledge if I had knowledge gaps in the application process of my base. And so I think that was something I would do a lot differently. And other than that, it was just sit down and grind it out the day of. And my test scores came back, and they were good enough to get into medical school, so applied. It wasn't something where I felt like I needed to retake it, where
Not
I
just
wasn't going to
any
get
medical school though, McGovern, baby. That's like I said earlier, it's a prestigious school, and
I appreciate that.
and they don't accept dummies, you know, like they're not accepting,
They accepted me, man. You know, I don't know. An argument could be made.
Well, it's very cool to see this journey, and you know the MCAT is a beast, and
Yeah.
and I think that strategy plays a big part of it, and you know there's obviously YouTube channels that could help people coming into the field study for exams like that, like Khan Academy. Shout out Khan Academy.
Yeah, that guy's great.
Yeah, they helped me out a lot through school. But you know, and there's other YouTube channels that kind of walk you through practice tests and bust down each question and things like that. So you know, it's a very big test. You know,
Yeah,
a very big test, and that led you into medical school, which you proceeded through, and now you're into your residency. So
Yeah.
what was what kind of challenges and struggles did you come across when matching with somebody?
Yeah, so matching is a pretty crazy process. The easiest way to describe it for a lot of people out there who went to college and were adjacent to Greek life is it's like sorority rush, but with your entire career and everything you've worked for. So there's a lot more on the line, and so essentially the way it works is you put out your application to all these programs that you're interested in, and they look at all the applications they receive and they decide who they're going to interview. And then I get an interview to schools A and B, but not to C or whatever, it is.
Right.
And then school A has their list of people that they interviewed. School B has their list, and every school and every program for every specialty has their list of people they interviewed. And then they create a rank list.
That's so nuts, actually.
And then I got programs A and B for these specialties or single specialty, however you decide to apply. I got programs A and B. All right, well, now I'm going to rank programs A and B, and I make a rank list. And the programs all submit their rank lists, the applicants all submit their rank lists, and it goes into a massive algorithm called the match. And the algorithm runs, and they check it, and it spits out where everyone's going.
Wow.
And it's all based off of how people got ranked. And so that's sort of the quick and dirty on how it works.
Right.
And then there's another layer to it where you can apply as a couple and you couples match. And that's what me and my wife had to do. And so you say, my rank list becomes attached to her rank list. And so this is my first choice and her first choice. And if we both don't get into those choices, you go down to your second choice. This is my second choice and her second choice. And if you don't get into that, you go down to your third as a couple, and fourth and fifth, and so on. And it can be like, okay, I got interviews only at school A or program A, and she got ABC. And so we say, all right, our combined rank list is me at A, her at A. And then number two, me at A, her at B. Me at A, her at C. And so you can mix and match like that too, and the combinations become much larger, and you're trying to do it by city so that you can stay close to each other and things like that. Because there are couples who will say we're okay with long distance, and they'll say, all right, me in Houston, you in New York, because that's where I want to go and where you want to go, and we're cool with long distance.
Right.
But the majority of people are like, all right, let's rank every combination of programs that we have in this city or in this geographic area together so that we stay together. And this is our first set of choices, and here's our second and third, and so on and so forth.
Right.
And that's pretty stressful. And I would say that the stress and getting interviews is kind of the first hurdle you have to get through, because you have to put together this application saying everything you've done over the past 4 years and more, and why you think you're a good fit for their program and all of that kind of stuff. And that's stressful. because it's your entire career. And if you're applying to something that's super competitive, there's no guarantee really that you even get an interview anywhere. And if you only get a handful of interviews, there's no guarantee that you're going to match. And then you have to figure out what to do for a year before you reapply and try to get into a residency program again. And so that's kind of in the back of your mind is like, oh, what if this just doesn't work out?
Right.
And that happens to people, unfortunately. But that's the first thing anyways.
What happens if they don't match? I mean, do they have to reapply for a new match like next season or whatever?
You can either take a year and reapply through the match again, or they have this other process they call it soaping, the soap process. And essentially after the match is finished, every program knows how many seats they have. And on the program side, they're trying to fill every seat because that means, on some level, like people want to go to your program.
Right.
And if you don't fill seats, that sometimes is a sign that something is maybe afoot in the program, something bad is going on there, or people don't want to go there for some other reason. And so programs are always trying to fill all their seats.
Right.
But when they don't, they basically broadcast that through this system, and they say, hey, we have an open spot. This is our program. This is the specialty, and we're trying to fill it. And these people who didn't match, they can apply to that process as well. Oh. And then, they go through that process is sort of complicated, and I don't think it's worth diving into too much.
Right.
But basically, they go through a separate mini match after they found out that they didn't match in the big one. And if they don't get anything in there, then they have to take a year off and reapply again next year.
Wow.
So there's no guarantee that just because you finish med school and you're a doctor that you're going to get into a residency program and be able to go practice.
Wow. And that is required, right?
Yes, essentially. You can graduate medical school and have your MD but not be a fully licensed physician, and you can go work for a like consulting firm or something like that and use your MD that way. People sometimes do that, but a lot of consulting firms and other businesses like that still prefer somebody who at least did residency or at least 1 year of residency.
Yeah, of course. Good
so you still should be trying to get in somewhere, even if that's your plan is to leverage your MD to go do consulting stuff. You should still probably go get some training.
Right.
So,
well, that makes sense. Yeah, it's insane the hurdles that you have to jump to be the guy. But once you're the guy, it makes complete sense, and even the degrees that I've gotten, I get the degrees and I get out and I'm like, that was, everything was good, but I wouldn't want to do it again,
Yeah, exactly.
But you are living this dream that so many people have, everybody even when we were undergrads back in the day, everybody was pre-med. Everybody wants to go into medicine, and everybody has this plan to become a doctor. And I think, with you being a physician now, maybe you could give me some insight on that. But, the thing is, I think that, because I'm on the MCAT Reddit page and all that stuff. And, a lot of posts that I see, it's like, it's all this struggle of looking into medicine and trying to, take the MCAT. They finally take the MCAT and they are introduced into this whole new world of more work, and so a lot of people, it seems like even in my job that I have now, they go through this process and they think that they're done after they take the MCAT, but it's really just a new pathway with a lot more obstacles to jump through. And
it's like hiking. If you've ever been on a really long hike and you've hit a false peak on the trail, it's like that, man. You get to what you think's going to be the peak, and you're like, all right, I made it to med school, and then you look up and there's another route in front of you, another mountain in front of you.
Yeah, there's a leopard on that one. There's a mountain lion,
But that's essentially how it feels sometimes going in. But I think applying to medical school, unfortunately, there's become and there certainly was, I think, even when I was applying, a decent amount of luck involved, even because there's plenty of there's phenomenal applicants
Yeah.
every year who they just don't get in for whatever reason. You can chalk it up to they fell through the cracks of the system. But at the end of the day, they're a phenomenal applicant. They probably make a really great doctor, and they just don't get in for some reason. And maybe it's has to do with the subjective part of somebody reading their medical school application and saying this one thing I don't like because of X, Y, or Z, or to me, this is a red flag. And, then you're talking about, well, why is that a red flag to you? To someone else, that might be, hey, that's applicable to medicine because of this reason. And, for the most part, they've probably got it down on, they've been doing medical school admissions for a long time.
Right, yeah.
But,
kind of see.
Yeah, people still come through who end up dropping out, and people still come through who end up, maybe not being as good of a doctor as somebody who coulda, shoulda, woulda made it into med school.
Right.
And that's, it's really unfortunate, but there is like a degree of subjectivity for medical school admissions. And really, it's like interviewing for any job. There's some subjectivity there, whether you were a good applicant or not. There's just a fixed amount of seats every year.
Yeah.
And the number of applications is growing.
Right.
And that's, that's makes it harder and harder on the medical schools to do. And, they can't accept every application at face value and read it all at face value. And so then they start setting filters on things, and whether they're, announcing that or whether the school is transparent about that or not, whichever one you apply to, like, yeah, we filter anything out that doesn't meet these criteria, versus a lot of them say now that they're holistic review. But sometimes it's like holistic review after you meet this criteria.
Right.
And so, and some of them are real public about that, which is nice, but yeah, it's kind of a bit of a crapshoot sometimes, which is truly unfortunate.
Do you think that it's geographic? Are they looking at the location? Like, you have people that grew up, went to school in this area. They're kind of they're native to this geographic region. Like, let's keep them around, or things like that. Or are they checking boxes in a sense of like ethnicities and bilingual and ability to do these different things? I mean, does everything kind of have a hand in acceptance?
I think so. And Texas is unique in the fact that there's a state law that requires medical schools their admissions have to be, I think the number is 90%. They have to be 90% in-state residents. Oh. So 90% of their seats have to be filled by people who are Texas residents.
I see.
And so that only leaves 10% for out of state, which, plus or minus if you're out of state, how you feel about it. But that can be really bad for them. But for Texas people, that's great. Right. I know that gives me a leg up in these Texas schools. Unfortunately, it gives you a step down when you apply to any out-of-state program, because they're like, well, Texas is going to take care of you. You can go to med school in Texas, and it makes it a little bit more difficult to get into programs that aren't in Texas. And they also know people from Texas generally like to move back to Texas. And so
it's Texas, of course.
Yeah. And so that also, I think, plays a role in that. That's a big thing in residency applications too, but it also boils down to, I think, what the mission of the medical school is. If the medical school is just like, we just want to produce great doctors, well, then geographics probably don't matter that much. If they're just trying to build, like, we want to have Nobel Prize winners and blah, 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 or whatever, then they probably care a little bit less about geographics. But if their mission is, we want to produce physicians who stay and serve our geographic area, then yeah, they're going to be more likely to pick people whose roots are here, they have family here, they have friends here, who give them those kinds of reasons in their interview or on their application. Right. And so geographics, especially in Texas, I think play a strong role in whether or not you are accepted in or get an interview. I think geographics play a pretty large role. Right.
Yeah, I know. I see people, or I've heard of people. I shouldn't say I see. I don't really know anybody personally. It's just stories that I've heard. But I've heard of people. They're scoring 518, 515, 518, and they're not getting accepted. It's I know. I think I saw an article. Probably it's been months ago. But this guy was he had got a lawyer involved, and they were bringing it to court for, I think, one of the, maybe this was a Texas school, I'm not sure, but they had applied for like 3 years straight and didn't get accepted, and their volunteer hours were exceptional. Their MCAT score was exceptional. Their GPA was exceptional, and they just weren't getting a hit. And so I probably should follow up on that and see kind of how that ended up, or if it has come to a conclusion yet. But yeah, it's like you said, some people just seem to slip through the cracks, and some of them could be very smart people, and I guess, like you said, also that goes vice versa. The people that don't need to be there slip through the cracks, and they end up there, and then you have dropout things and stuff like that. But yeah, no, it's very insane how it all works. How was your interview process to get into medical school? Like, what kind of obstacles did you run in there?
I didn't feel like I received that many interviews, which in the end is fine. I ended up at somewhere I really wanted to be at, so awesome. But I got an interview at a place out in Florida. I got an interview out in El Paso, and the only real interviews I did were one in the Rio Grande Valley at UT Rio Grande Valley. And I ended up scheduling my interviews back to back because I got my interview at McGovern like a few days after, the invitation a few days after, and then the possible days I could schedule up, one was like 2 days after my UT Rio Grande Valley. And so I was like, well, I'm going to drive down to the Rio Grande Valley.
I heard their facility is really nice up there.
Yeah, the school was super nice, and it's, sort of the only healthcare area for a large geographic area, and so they get a lot of people coming into them too. And so, but the facility of the school was like really new, really nice. They just graduated their 5th class, I believe. Wow. And so it's still a pretty new program down there, and so facilities are new, they're nice.
Right.
And I had a really good time down there. I really enjoyed my interview. I thought the interviewers were great. I would say driving down there and driving back was an obstacle. That wasn't the most fun I ever had. I think that was...
What's the drive down there?
It's like, I think 7.5-ish. Yeah. And so that was a lot.
Whole MCAT.
Yeah. And then I was thinking to myself, I was like, man, I'd have to do that every time I wanted to go back home and see any family or friends. And I was like, that's a lot.
That is a lot, yeah.
And so that was the only knock I really had on that school. Everything, I loved the interviewers, thought they were super sweet people, super nice people.
Yeah.
I got along with them in my interview. It was really conversational, which was a welcome
authentic,
relief. Yeah, and authentic. And a lot of schools and residency programs are moving to that now, because once you've made it to the point where the admissions committee has, for whether it's the school or the residency, once you've been offered an interview, the interviewer knows that you have met baseline criteria. Right. You've got the grades. Your MCAT score was enough. You did enough volunteering. You showed all the things that an admissions committee wants. So then the question really becomes, like, who are you, like, as a person outside of medicine? And can you have a conversation with people? Because in most specialties, you have to talk to people.
Right.
And so if, you do all these great things and that's all fine and dandy and you crush everything, but you simply can't talk to people, you have no interpersonal skills, it's going to be really tough for you to be a physician, most likely, because the vast majority of specialties require you to have some interpersonal skills, not just for talking to patients, but you have to talk with your nursing staff, you have to communicate with other services, and you have to communicate with hospital administration, and you have to do all that effectively, and you have to do all that efficiently. So interpersonal skills are huge, and a lot of interviews, that's really what they're trying to tease out, or what's this person what are these person's interpersonal skills like? Are they, good, bad, great, terrible? And then also trying to tease out almost like your attitude towards things. And if they can catch you off guard on something, how do you handle that pressure? And so putting you in situations where, a lot of these students they shine on paper because they've done the work, and they get to the interview and sometimes flounder because they get put under pressure and they flounder. It's like, well, you're going to be under the gun a lot in medical school and in medicine in general.
Yeah.
And you're going to be put under pressure, like in pressure situations a lot during the next 4 years and in your practice and in residency. And there's going to be a lot of pressure in residency, the long hours. How do you handle that kind of stuff? How do you handle it if I disagree with you about something? And so really just assessing all those kinds of things. I think a lot of people flounder in the interview, and that costs them. So interpersonal skills are, I think, really what the interviews are about. But
Yeah,
I
that
loved
makes
my
sense.
interviews there. And then I drove up to Houston, stayed a night with a friend, and spent a day prepping and going over my application, making sure I remembered everything I had said in case something gets brought up.
Right.
And then
What kind of questions are they asking you to catch you off guard?
I think one of the in this was a residency interview, which I appreciated this because I thought it was like a fun mental exercise,
Right.
which is super nerdy, but it's fine. Like you got into medical school, like you're a nerd on some level.
Right.
You had to nerd out on something to get into medical school, so it's whatever. But they essentially like pop quizzed, and they did it as a group, so it was like crowdsourcing answers, so it wasn't as stressful. But I will say this program, in doing that, it's easy for them to tease out who's, a type A personality and who is willing to put themselves out there and potentially be wrong in front of a group of people, and so they're almost certainly using that as a piece of information when they're ranking people. But they're crowdsourcing information, and they just walk us through a case like, hey, this patient came in with this complaint. What do you want to do? And like that's kind of all they give you up front.
That's pretty fun,
and you're
though.
like, all right, well, like let me go walk into the room first, and then like you start walking through, like, what do I see? Like, what's the patient look like? All right, like I'd like to do this. I'd like to ask the patient this, and you start, and then they're like, all right, pause. What are y'all's thoughts? Like, what are you thinking is wrong with the patient? And so they get an idea for your knowledge base, where your head goes. How close are you to being on the money with what's going on with the patient? And then that's like a med school one that was used. I think in my Rio Grande Valley interview, I got asked about like the price of insulin, and but I think I might have spurred that. I don't recall entirely, but we started talking about like the price of insulin. This is before it, caps had been placed on it and stuff.
Right.
This is 4 years ago. And so we started talking about that. It was kind of like a hot button topic. So you kind of have to watch what you say and how you say it.
Yeah.
And that, is something that could get brought up, but that's relevant. It's like a current event, current issue, hot button topic. It's like, oh, well, and obviously the applicant would know that this is a hot button topic. So how do they perform when I ask like a, not necessarily loaded, but just kind of like a sensitive question?
Right, yeah.
How do they respond to that? And so I think that was one at Rio Grande Valley that I got asked about, that I was like, okay, that's, a little more involved.
Yeah.
And then in my McGovern interview, I was asked, what do you fear most?
Oh.
And that was like, okay, this is like the pop quiz question, because that's a left field question for a medical school interview.
Yeah.
And so I think that was the one in that interview that was very, how's this person respond to this question? Are they reflective? Do they work through this? Do they talk through it out loud? And that kind of thing. And it's not necessarily a question that you go into an interview prepared for. Because there's a pretty standard list of interview questions, and you can get asked some pretty wild questions in an interview. But usually, what do you fear most? That's like pretty personal.
Yeah.
And so asking, how does this person respond whenever a total stranger asks them a deeply personal question? And so just random things like that.
I know. I'm sitting here thinking, like, how would I even answer that? I would probably project on myself, like, in some form or fashion. But yeah, that's interesting. Yeah, I didn't know that I knew that they asked kind of oddball questions, but that one's an interesting one.
Yeah, there was a guy who I love and respect a lot. He's one of the attending physicians there, and I think he was asked to stop doing this because it didn't play well on the applicant side. A lot of applicants didn't like it, but he had like a kidney stone in a jar, and he would ask them essentially to figure out what this is. But it was like a game. But the rule of the game was you can ask as many questions as you want, but you can't ask, like, what is it? Or you can't ask things that make it a dead giveaway.
Yeah.
And so there were like a couple of rules to the game, but you essentially all that he was trying to do was assess you're under pressure now because you're in an interview and you're like, I have to figure something out in an interview in a high pressure situation, high pressure, high stakes. And then B, it's like a problem solving thing.
Critical thinking.
Yeah. What types of questions does this person ask to figure out what this is? Wow. Do they ask like, is it made of rock, or is it from the human body? Did it come out of a human? Did you pick it up off the ground? Blah blah blah. How trying to figure out, okay, well this is what this looks like to me. Well, where could it have come from if that's what it looks like? And trying to figure out that it's a kidney stone.
I think that's a great way to kind of assess somebody's thinking. Ability to think. Because that's kind of what the MCAT does, but on paper.
Yeah.
And then actually applying that to real life, I think is probably the most crucial.
Yeah, I think I was told by some admissions committee person at some point, I think after I got into medical school, that, and I could be totally wrong on this, but for some reason I remember this, but that the CARS section, which is like the critical analysis reasoning skills, I think is maybe what that stands for.
Right.
But that critical thinking section, the score on that is one of the best predictors of how well someone will do in medical school.
Wow.
And because once you've learned the baseline knowledge of stuff in medical school, taking care of patients is a lot of critical thinking and knowing, well, it can't be this because they don't have this, or this lab value immediately excludes these diagnoses, that, or things of that nature, and then parsing through things. And it's a lot of just critical thinking and working your way through problems.
Right.
And so that's apparently, if I remember correctly, is one of the greatest indicators of how well someone will do in medical school.
Yeah, I could see it. I could definitely see it because, you're not applying math or anything. Mm-hmm. It's like they give you this extremely difficult section to read, and then you have to answer extremely difficult and questions that involve understanding the whole situation and kind of like reading between the lines.
Yeah.
So I could see that, and that kind of can tell if a person is a thinker or not. Because
absolutely.
I feel like a lot of people are book smart, and that's a great thing to be, because books are amazing and they have a lot of information, but real world application is just a little bit different.
It's the next step.
Yeah.
Yeah, because you can score off the charts on the chemistry section, the physics section, the psychology, sociology section, but a lot of that, to a certain degree, I haven't taken the test in 4 years, so maybe it's changed, but to a certain degree or at a certain level, that's all just what is your knowledge base like? Do you have the knowledge to answer these questions? You don't necessarily have to apply a lot of things. It's, do you remember this formula straight up, yes or no? And if you do, cool, you can get the question right. And if you don't, tough.
Yeah.
And then, but the CARS section, the critical thinking section is, I'm going to give you this paragraph with a lot of fancy vocabulary, and you need to use the context clues to figure out what's going on and what's being said, and then make an interpretation about it. Yeah.
The story could be about anything, it could be about something that happened in 19 whatever, somebody traveling, or a painter's thoughts on somebody else's painting,
They can give you an excerpt from Great Expectations for all they care, man. They'll give you anything under the sun, and it's just, all right, my job is to think about what's going on and make interpretations.
To think that's the main thing. So, I know we're jumping around a little bit, and we've hit.
It's emergency medicine, man.
It's emergency. So we've touched on a lot of different things, and a lot of hurdles that you have made in your career to get where you are today. Now, I guess my question would be, after all of this hard work, what was that feeling like on match day when both you and your wife received a match in Houston? I'm assuming, was that your first choice?
Yeah, it was.
I mean, it's the best spot. I mean, you were already in Houston. So what was that feeling like? I mean, it had to be an excitement like no other. I mean, because it
Yeah.
took a lot of work to get there, and getting that acceptance is just like a breath of fresh air.
Yeah, it's validating.
Yeah.
It's validating. And so this is another like weird thing in the system that is unlike any other profession. But so that happened on a Friday. On Monday, they send out emails to every medical student who applied to match, and they say you matched or you didn't. And then you have a week to sit, because if you didn't match, then you have that week to do that SOAP process that we talked about earlier, that like extra mini match to try and get in somewhere. So that's what that whole week is about. But if you matched, you're just sitting there for a week like, man, where is it? Like, where on my rank list did I end up? You know, did I get my number one?
I see what you're saying.
Yeah.
So it tells you that you've matched, but it doesn't tell you where you've matched.
Doesn't tell you the program, doesn't tell you a city, doesn't tell you a geographic area.
God.
You're sitting there for a week. All right, I matched. I'm going to be a doctor in this specialty that I applied to, but I have no idea where yet. Wow. And so that's a little stressful, a little fun, and pretty much the whole week you're just hanging out with friends, and you're either commemorating or commiserating with friends for pretty much a whole week. You're either like, oh, we did it, or like, hey, can I help you do anything? I know you're stressed right now trying to do the SOAP process, you know.
Yeah.
And so there's a little bit of that going on both ways, and that's both fun and tough if you have friends who didn't match. And so you're going through that whole week, and then Friday rolls around and your parents are there. Some people bring like their childhood friends there and things like that. Their best friends will come in, and it's just like a ton of people all packed into this room that's too small, because you would have to go to like NRG to have enough room for everybody.
Right, yeah.
And so everyone's packed into this space, and everyone's excited because their loved one is about to figure out where they're going to spend the next X amount of years at. Wow. So it's just a lot of buzz in the room. And the way our school does it is everybody one at a time gets their name called in no particular order.
Oh, wow.
And so if you're like the first person
like the
to
NFL draft.
Yeah, man. And if you're the first person there's like about 240 of us in our class.
Wow.
And if you're the first person to get your envelope, you have to wait for everyone else's name to get called before you open yours up, because the thing is, everyone opens at the same time.
Oh, wow.
So you hear a lot of, shouts and screams of joy throughout the room, which is awesome.
Yeah.
And then, you can tell when some people didn't get what they had quite hoped for, but they matched, so they're still going to go be a doctor and stuff. But most people are generally just like, thank God.
Yes.
It's just a relief.
Yeah.
I did it. I know where I'm going, signed, sealed, delivered. I'm done. Like, for all intents and purposes, this is the finish line, as just as much as graduation day is.
Yeah.
Because it's like I know like my future is set here now, which is really nice. So match day is an experience for sure.
Yeah.
So a lot of anticipation and anxiety, and then just like kind of just a massive breath out.
Yeah.
And breath of fresh air after that.
Well, I think you landed in the best spot possible. I love Houston. I love everything about Houston.
Yeah.
And Houston's medicine especially is just
special,
out of this world. I mean, it's really beautiful. The I guess the culture that the medical center has created. I mean, there's people traveling all across the world to come to the Texas Medical Center. And when you get over there, I mean, the first time I went to the medical center by myself, as a career, I was like, whoa. Like,
it's a lot, man.
And coming from a small town, I mean, I grew up in China, Texas, and I'm over here looking around in all of these big name hospitals, just huge buildings, and there's so many people there, and of course Herman Park is out there, and
right there, man.
There's people healthy running, and there's a golf course. I mean, I was just like, this is like a whole vibe in itself, and and the medicine is a whole nother area of just amazement. I shadowed in interventional radiology at MD Anderson, and I kind of saw some of the stuff that they're doing over there, and I mean, it's ridiculous. I mean, man, the technology that they have is outstanding. And so Houston is the best spot. I live in Houston. I love Houston. But if anybody was to ask me, and if I wasn't even from here and I just kind of got to tour the area,
Yeah.
dude, Houston is the place to be, you know?
Yeah.
And I think like we were talking about before we started is, you know, you could pick whatever you want and just be that, you know,
Yeah.
in medicine, in the medical center, because there's so many specialties, there's so many niches for people that just have a desire to learn, you know,
Yeah.
and it's amazing. Everybody's flocking over here.
Yeah, it's because it's not just clinical stuff. The clinical stuff is great, especially for emergency medicine. The program I'm in with UT Health is
Right.
all like we rotate at Memorial Hermann, so we get Hermann Trauma, which is currently the second busiest level 1 trauma center in the United States, and it's like the second busiest helipad in the world. Last the numbers were ran. Last I read the numbers, it's the second busiest helipad in the world.
Oh my God.
And it's only second to like something in like Baghdad or something like that.
Wow.
And then, or maybe and I think it's the busiest non-militarized helipad in the world, or it's something like that, or in the Western Hemisphere. It's crazy, man. The amount of traumas and air ambulance, life flight that comes in and drops off patients at Hermann is pretty insane. And so that's one part of the emergency department.
Yeah.
And then you have the pediatric emergency department, which has its own set of, you know, however many beds they have. And then they have like a general medicine side of the emergency department where people with not trauma problems tend to go, not traumatic injuries, but, you know, I'm like chest pain, shortness of breath kind of thing. And they go to there, and that's a whole nother set of beds there. And so it's this massive emergency department at this huge facility in an even larger medical center in a massive city, you know, one of the largest metropolitan areas in the United States.
Right.
So it's almost like the everything's bigger in Texas kind of set up for that part of the training. And then you go out to LBJ Hospital, which we talked about earlier, and you have these people who are unable to access healthcare, and you get to really help them through the Harris Health System, which is really nice, and you get to provide care to people who probably otherwise wouldn't be able to access it at all if that hospital didn't exist, which is really a beautiful thing. You know, I wish they were able to access their healthcare, and that wasn't a beautiful thing. That beautiful thing didn't have to exist, but we are where we are, and but we do have this thing to help these people, and it's a phenomenal training site, and the people are great. They love what they do. The attending physicians are phenomenal. They're great teachers, and I've gotten to work with them a pretty decent amount, and I've loved every minute.
So where do you see medicine rolling in the future? Because I mean, you know, even the past few years, AI has kind of ramped up, and you know, we have all these technologies. Startups are coming out of the woodworks to make all these things, and you know, so where do you see physicians and I guess particularly emergency medicine? Do you see any applications of AI in emergency medicine in the future?
Yeah, I think there's some cool stuff being used out there right now, not in emergency medicine. I know there's some AI that's been used for radiologists, not to read the images. That's been done, and you know, plus or minus on that, there's still things that, you know, get missed, and you can't say, well, the AI read it and they missed this. Sorry, because you know, it's America, so you have to be able to sue somebody. So you would have to be able to like sue the company or sue the radiologist who was supervising the AI. I don't know, but I've heard of some groups out there that are using AI readings to triage or organize acuity, how bad the reading looks, how bad the pathology on the reading is, to send it to the radiologist and say, no, you should read this one next. This one popped up and the AI read it as having something really bad. You need to double check this one ASAP.
So like a severity percentage or something. Yeah.
So it's like a severity ranking. So I've heard of some radiology groups using that. I think that's pretty slick. I think that's pretty smart. Yeah. And then I think that for a lot of specialties, I think AI will be used to make them more efficient in terms of writing, like note writing and things of that type, especially in emergency medicine. Like right now we use a lot of things called dot phrases where I can say, you know, like and they all start with a period on the keyboard.
Right.
And so you would say period or dot, and then enter something, and it pops up like almost like a template for you to use. Or
and you just fill in like
you just fill in
per patient.
Yeah, based off of what the patient told you. You say, all right, this note needs to be set up this way, dot, phrase, and then it populates it, and you can fill it out for the particular patient. And I think AI will probably be used in that nature in emergency medicine, because a lot of or significant amount of emergency medicine is also doing procedures, and AI is quite a ways away from being able to do a procedure. Having a robot that does a emergency medical procedure is probably still quite a ways off. And so I don't see anything like that happening for quite some time.
Yeah.
So, I don't even know if that would be in our lifetime.
Yeah, I know that's big, especially because it would be hard for AI to read each patient, as far as like their situation. You have a certain tumor, and the tumors are different sizes or things like that. I think it would be real tough to incorporate a piece of machinery that's making the incisions and doing all this stuff. But who knows, man?
Yeah.
We're progressing
It's a rapid
faster
rate.
than I know. Yeah. So, but yeah, the possibilities are endless, and I'm excited to see what they come up with. But yeah, I think in specialties like radiology and things like that, I think that's excellent, and especially for for charts and things like that. I mean, that's gonna it's gonna put a dent on the scribes, but
it will.
But I always like the ability to kind of cut one project out to allow more time to do something else, and
of course,
and things like that. So I'm with it. I like the progression, and I like the advancements, and it's endless. And I know it scares some people, because it is advancing at such a high rate, and the fear of what it can be used for, but there's a lot of good that could be done,
Yeah. And if you could have, I think now that I'm sitting here thinking about, if you could have AI running in the background, and the emergency medicine physician says like, all right, this or these are the diagnosis, and it knows who to call and who to contact, and it goes ahead and gets them on board for you. That's probably an application that I could see coming, because that's just less phone calls the doctor has to make to get people on board.
Yeah.
And then the consulting physician from the other service can just go look at the chart and say, we don't want to do anything. Let me call them and make sure I've got the story right, and we'll do X, Y, Z for this patient. So
yeah, that would be an excellent application. Yeah, and I know we're hitting a lot of topics, and like I said, we're jumping around, but you also have your master's in public health. Like, I mean, how was that?
man.
I mean, that's you have a very, very broad idea of science, and because you have biology, the study of life, you have business, you have leadership, and chemistry, and also the idea of managing a full population at multiple scales. And keeping health at its greatest level. So, what was that like?
It was pretty nice. The classes overlapped a lot with a lot of the things that we talk about in medicine. We talk about a lot of public health stuff. So I did it also through UT Health Houston, and it was nice, and just a couple of courses a semester kind of thing as I'm going through medical school, and it's pretty manageable. There was only a handful of times where I was like, oh man, this is a lot now, but pretty much for the majority of the 4 years, it was very manageable. Usually it was more like deadlines and things I'd put off when I was like, oh, this is a lot now. It does. But it was pretty good. A lot of exposure to a lot of different and or new ideas, things that people hadn't talked about in front of me before, different ways of looking at things or approaching things.
And that was during COVID that you were
started it? Started
I mean, that's
so,
a hot topic to.
Yeah,
I mean, it's
was like every discussion board, man, was like, let's talk about COVID and public health.
SARS-CoV-2.
Yeah, so that was an interesting time for sure, because that was a lot of the assignments. They were like, we're seeing this real time right now.
Nuts,
Like this is exactly how this is playing out, and this is what we teach, and you get to see it in real time, which is pretty
like
cool.
when I like to be in like a political science class during elections. Like that's the best time.
Yeah.
So yeah, I can imagine that, you know, that was a big topic and a big level of discussion, and the epidemiology of and things like that. So yeah, that's crazy. And I mean, if you were to go back, would you do anything different?
Do I have to go back?
No, you don't gotta go back.
I wouldn't go back. Yeah, I wouldn't go back. No, it's like like you said, it's just like, it was great. I'm glad I did all this stuff. I would not do
You know
it
who
again.
Jelly Roll is?
Yeah.
The front windshield is bigger than the rear view mirror for a reason.
Yeah, amen to that, man. Amen to that. Yeah, I love what I do and what I've had the opportunity, been blessed to have the opportunity to do all these things and, you know, pursue these degrees and learn these things. But I don't know that I would do all this work again. It's a lot, man.
Yeah, it is a lot.
But you know, you only get one shot, so I'm just trying to make the most of it out here.
Wow. Well, cheers to you for chasing your dreams and succeeding, because, you know, a lot of people, they want things and they say that they want them, and you know, they may really want them, but they're not taking any action to follow through, and or even no action to figure things out, you know, because I think that, you know, life is a series of experiences, and each experience you learn something so you can make a decision moving forward. And, you know, it's just kind of a nice base of experience and base of knowledge that you could use to move forward, which is the past. And so, you know, like I said, cheers to you, man, because you have made it so far, and you've done a lot of things that a lot of people will never do in their lifetime. I mean, you realize, I mean, it's a big ordeal, and being a doctor is amazing. And I think the reason I'm so astonished with it is because I think we were in our first semester at Lamar, we were in classes together, you know,
Absolutely,
and so
man.
Just that character development and maturing over time, you know, you kind of see goals that people set and achieve. And so that's, you know, kudos to you, because it's a very, very big deal. And like I said, you know, you're living the dream of a lot of people right now, you know.
I have to remind myself of, thankfully I have a buddy who's in law school right now. And at one point early in his time in law school, I remember him asking me, like, man, like, this is a lot of work. How did you keep going in med school when it got tough? And I was like, man, you got to look back. Like, you've made it to law school now. Like, you are in law school now. As long as something really bad doesn't happen or you don't flunk out, like, you're going to be a lawyer.
Right.
So, like, kudos.
Right.
Like, you need to give yourself at least a little bit of a pat on the back, because you've made it to this point that you said you were going to make it to, this goal that you've set. And then B, man, you 4 years ago in college, you would have done anything to be where you're at right now.
To be sitting right here right now.
And you're like, and I would start complaining about stuff, and I'd be like, dude, me 4 years ago would tell me right now to, like, shut up. Like, you made it, dude. Take advantage of this opportunity. Do everything there is to do. It's like you made it to this point, and there were other people who would also give anything to be sitting exactly where you're sitting.
Yeah.
And I think, especially if you're pursuing, like, a professional degree or something that's really difficult to attain, and you hit these checkpoints along the way, you have to take at least a second to look back and be like, all right, cool, pat on the back. Let's attack the next step. Let's get to the next checkpoint. And then when things get tough, you kind of have to look back and say, man, I didn't come this far to stop right here.
Right.
Because me at the last checkpoint would kill to be at this checkpoint.
Yeah.
And would absolutely be telling me to quit complaining and go get after the next one.
Yeah, chipping away at it.
Yeah. And I think you really have to kind of look at it from that perspective for a lot of things in the, chasing like professional degrees and stuff like that. It's, man, there are a lot of other people who would not complain right now, and you need to keep moving. And this is also, for me personally, and maybe it's this way for a lot of other people, and I'm sure if a lot of other people thought about it this way, they would say, yeah, I can think of those people too. But man, nobody's done these types of things or achieved any type of thing 100% on your own.
Right.
Sometimes the idea of the self-made man to me is kind of like funny in some aspects, because, and even if you were homeless at some point and now you're Steve Jobs, there was still somebody who did something for you along the way. Right. There's somebody who taught you something. There's somebody who went out of the way to do a favor for you that helped you get a leg up on something or get to the next step. There's somebody who helped you along the way. If you have any modicum of success, for a lot of people it's their parents, and then for people whose parents weren't around, it's mentors or college professors and things like that, teachers in high school who went the extra mile even though they 100% didn't have to. And maybe you don't have a lot of like people in your life who have done things for you like that, but if you're grinding away on trying to start this business or do this or do that, and you're watching this YouTube channel, like, yeah, that guy or girl put out this information and maybe they've made it big time, but it's still helping you. You're still learning from that person, even if you don't have like a actual real life relationship with them. You're still getting this help from this person. And so nobody's done anything and been super successful and been 100% self-made. Right. Someone helped them. Yeah. And I think when you take a look back and you say, hey, that all these people did these things for me, the least I can do for them is to keep going so that I can at least pay that forward to somebody else. I've always said I can never pay back like my doctors, the nurses, my parents. I can never pay those people back for all the things they did for me. But if I can keep chipping away and I can keep moving forward and I can keep doing the next thing and getting to the next checkpoint and achieving the next thing, that allows me to pay it forward to other people.
Right. Yeah. So I think that collaboration, whether it's even in just a thought process or anything, is really necessary. I mean, that's what makes the world go round. And you said you can't pay these people back, but you have by being successful in what it is that you do, because
and maybe for them that's enough. Yeah. But for me, I'm like, if I was truly going to pay you back for everything, monetary, and then plus interest, plus the whatever value was decided for all the non-monetary things you gave to me, whether it was friendship, whether it was being my parent or whatever that thing, my mentor, being there that one time I needed someone to call, all those things, dude, no shot.
Yeah. Currency's overrated though. Currency, like the actual dollar, is overrated. Effort, I think a lot of people don't realize that effort is just, I think it's the best currency, man.
Huge, man.
It's the best, because without, money could buy you things, but so can effort.
So can effort. Any, social capital. Yeah. Having some social capital with people and, having been there for them or having done this favor for them, social capital can get you a lot of places. Yeah, can get you out of a bind, man, too. And then also sometimes it just leads to really great friendships that it's not even, things like that blossom. Relationships like that can blossom out of a social capital type of situation where it's like, hey, I'm just going to do this favor for this person, like just because, and maybe one day I'll need them, maybe one day I won't, but then, that ends up being, your best friend or one of your best friends, and then you go to their weddings, you watch them get married, you watch them have kids, all that type of stuff, and that's all just because you were like, hey, I'm just going to go put in this effort for this person, and maybe I get something out of it, maybe I don't, but I'm going to go put in the effort and see what happens. And I think that's huge. And I don't think a lot of people recognize that. I think it's Coolidge was the president. He has like a really famous quote, but it's basically about just, man, like
you can be talented, you can be smart, you can be all these things, but like, it doesn't mean anything if you don't put in the effort.
Yeah.
And there's like, it basically says like there's a ton of talented people out there who do nothing, ton of really smart people out there who do nothing with it, and there's just, they never put in the effort. And that's, you know, the problem with, you know, for some of those people trying to achieve, saying they can't achieve the next step, and it's sometimes, not always, is a matter of effort. And it's a very like American idea, especially, you know, like coming from small towns, definitely like a small town American ideal. And there are certainly other hurdles for people to overcome in life. You know, people get knocked down all the time by diseases, and they were working really hard. They were putting in the effort, and then tragedy strikes, and they maybe literally can't recover, or now they have like a physical disability that keeps them from attaining that next checkpoint, and then the effort is not enough to get to the next checkpoint because they have an actual limitation. And
Right.
at that point, I think it's about, you know, pivoting and how resilient are you and all that kind of stuff, which is tough to overcome in some situations.
Sure.
But
Yeah.
it is some of the greatest stories of humans are about, you know,
Yeah,
resiliency
you're right,
and things like that.
Isn't it funny how things work out?
Yeah.
You know? I mean, it's crazy. You know, something could happen one day that shapes the rest of that person's, you know, life and future. And sometimes, you know, because humans, you know, as humans, we're smart, you know,
You can figure some
resilient.
things out.
Yeah. And so one event may shape who you become, you know,
Yeah.
and it's really a beautiful thing. And you, sir, have done so much. And like I said, you're not just talking about it. You're being about it too. And it's very very inspirational. And you know, what advice briefly would you give to somebody starting out? Like, I mean, they may just be starting out as an undergraduate. But what advice would you give somebody?
I would say, and I think this is advice I gave to a lot of people in undergrad who are, you know, freshmen when I was senior or whatever in the department, or if I knew them through Greek life or however I knew them, was always just like, man, there's a lot of opportunities out there, and some of them will be presented to you. And I was like, some of them you'll have to go find, and that's fine either way, but you should take advantage of every single opportunity you can. And I think that especially when people are looking at their professional careers, you know, I'm not saying you should take every, you know, business opportunity that comes your way. There's some like bad business opportunities that get presented, but when it's, you know, the chance to, I don't know, go to this conference or go do this thing with this person, and it's something that if you can see the worst outcome being, man, I feel like I wasted my weekend, or I feel like I wasted this time.
Right.
And yeah, you can't get that time back, but now you know. Now you know what that experience held or what that was like, and you didn't leave a stone unturned, and you figured out what was behind each door, or you know, most of the doors. You figured out what was behind most of the doors, and you saw where most of the paths led, and you garnered all these experiences, different experiences and varied experiences that are going to help you make better decisions down the road. They're going to give you better perspective on what other people might be thinking.
The art of wisdom.
Yeah, how other people are trying to not how they're trying to, how they are looking at things. Other people's like world.
Yeah,
I was trying to
viewpoints.
avoid using the buzzword worldview, but that
It's necessary sometimes.
yeah, and so I think just really trying to attack all those opportunities and see what they hold, because you never know, and you never know who you might make an impression on, who later on comes to you and is like, hey man, I remember you from this. I don't know if you remember me, or like a job opportunity that they have, or they want you to come join this board for this company, or they want you to come consult on this, or XYZ. Those things happen the more you go put yourself out there. One of my buddies used the term one time. I'm sure he ripped it from somewhere, but like increasing your luck surface area. And
That makes sense.
yeah, and so trying to, you know, if you're going to be rolling the dice all the time, trying to have as many possible outcomes and seeing where they all could possibly lead to. I think that's huge, especially if you're, you know, when you're a lot younger, when you're like fresh out of high school. It's like, man, not nobody, but very few people fresh out of high school start something up and make millions and billions and millions. A lot of these people that become hyper successful, whether it's, you know, financially or otherwise, a lot of these people that become hyper successful, they just dabble in all sorts of things for their first like 25 to 30 years of their life. And they're just trying to figure it out. But then they learn enough about all these different things that it helps them put together something really special. And I think that's where a lot of people miss out. A lot of our society today is encouraging people to, even in high school, to, you know, specialize early. You see it a lot with like sports, you know, parents saying, you know, no, like if you want to go pro in this, you should only play this one thing. And so, you know, sometimes it works out for people and a lot of times it doesn't. And, you know, maybe they would be better off for the rest of their life if they had dabbled in other things and made other friends and had other opportunities to go see how other things work had other viewpoints to put together and solve a real world problem using that, because they have like this one random memory. It's like, well, we used, you know, I went on this podcast one time and he used this to fix this. And that's kind of like a similar problem in the workflow here. So what if we did this to fix this? And it's like, oh, well, yeah, I came up with that because I went to this podcast one time. And, you know, just weird random stuff like that happens. The more you have, the more like surface area you have of experiences in different realms. And I think that's one of my biggest things with when you're really young is just, man, just go get after it, go have fun experiencing a bunch of different things. And, you know, that's not to say like don't have a plan that you're on track with, but don't be afraid to go down a rabbit hole.
Test the waters.
Then, go down a rabbit hole while you're still, you know, the car's still running on the main path, and you just kind of stick your head out the window and reach your hand out and see what's on the side a little bit. And then
touch the
air, the
leaves,
leaves,
the branches off the trees, you know?
Yeah, while you're going down your main path and see what else is kind of out there. And maybe instead of going down that road, you end up making a left turn and you end up somewhere you never thought you'd be. But and you can always try to go get back on the path too. You know, it's one of those never too late things, I think.
Yeah, all paths are connected, that's for sure. And that's really cool coming from you because, you know, like I said, you've made it here, which is incredible, but you started from, you know, pretty humble beginnings, you know? I mean, you worked at Sonic and boutiques and things like that. So you also have been, you know, over your years in, you know, achieving your goals, you were reaching your hand out of the window and touching the branches, you know, Sonic, boutiques, you know, you had other small end jobs, marketing jobs.
Yeah, I worked for a marketing job at the university and worked at a brewery that opened up in Beaumont and like was running their social media. So like marketing adjacent, did like some of the bartending there and just kind of whatever opportunity like I saw, I would say, you know, do I think this is worth pursuing? And what's the worst thing that happens if I message this person and say, you know, do you need an employee or something like that? It's like, well, like the worst thing that happens is they just say no. And I'm like, oh, well, that's that. And the best thing that happens, like I get to go experiment with this new job and see what this is like. And I get to learn all these cool, new, fun things.
Right.
So,
well, you sir, you've done a lot of things and you are still doing a lot of things and most of them are very cool. So
thank you.
Just to kind of wrap this bad boy up, where can people find you at?
I'm on social media on pretty much every platform is at Cade Johnson 23. That's my go-to handle. Jury's still out if I'm gonna make like a professional, like a doctor professional account. I haven't decided on that yet, but that's me on social media. And then you know, don't need to find me at work.
Yeah, exactly. Like don't come looking for me. I'm busy enough.
Yeah, stay out of an emergency situation because that's not good for your health, man. So you know, hopefully you don't need to come see me at work.
But if anybody does run into Cade, he will take good care of you.
Yeah, absolutely. That's the job description, man. But yeah, we'll see where life goes from there. But that's how you can find me on social media. Yeah.
All right. Well, Mr. Cade Johnson, you have a lot of letters behind your name. MD, MPH, MBA.
Yeah.
Am I missing anything?
No, for now.
For now. Oh,
For now.
You plan on getting some more letters back there?
You can get like other like certifications and stuff, but nothing crazy.
Yeah. Well,
So,
I can't wait.
Not another degree, I'll tell you that. I'm done.
Well, you say that now. You never know.
I guess that's true. Might be a stone that needs turning over at some point.
Well, again, you sir are you live an impressive life, and you're a very good leader, and you're a good representation of Houston medicine and everything that entails. So I really appreciate you for coming. I'm very proud to call you my friend.
Oh, no.
And yeah, until next time, man.
Dude, good seeing you, man. Thanks for having me on.
See you.
It was a pleasure.